Hey guys, welcome back to my channel. I know it's been a while. I haven't filmed in like 3 weeks, I think, but I'm back. I'm back for now, at least, and I just wanted to talk to you guys about clinicals. I actually have so many things that I want to update you guys on, but this video will be way too long, and honestly, like, I have a very limited amount of time because I have some homework I need to do. But let's get started with this video. Let's talk about clinicals, how it's going, and all that information. So before we get started, if you are new here, my name is Wendy. I am a registered nurse. I'm also currently a family nurse practitioner student. So on this channel, I actually do share my nursing advice, my nursing journey, as well as bits and pieces of my life. So now let's get into the video. First of all, I am currently doing my first NP clinical rotation in family practice. So although it is a clinic where they provide family like medicine services, my preceptor does not see pediatrics or women's health. I've only been there for 3 weeks, so thank goodness we are down to 8 weeks of this class and of clinicals. And honestly, clinicals is not bad at all. It's not bad. I'm learning a lot from my preceptor, from the patients, and just from the interactions that I'm having, and just being able to actually do like assessments on patients, like physicals and all that, is so much better than trying to just learn it from a book, because I really need hands-on. So it's helping a lot. But the problem is that it's just so hard to balance everything. And it's not that the schoolwork is hard, it's not that clinicals is hard, it's not that work is hard, it's just trying to balance it all. It's insanely hard, like super hard. And honestly, like, you guys, I've just been like experiencing a lot of anxiety, especially during my second week. But I also wasn't really taking care of myself. So I started to just like focus more on me first, give myself some time, like doing yoga and all that, because like it starts to get to you. Like I said, it's not hard, but so far I have completed, I want to say 53 hours of clinicals, and I've seen like over 100 patients already. So once again, I do have a video where I talk to you guys about how many clinical hours I need and all that, and I'll link it up here. Now, the problem is that, well, it's not really a problem, but it's just a little more inconvenient because my preceptor is currently only doing half days at work. So it kind of sucks. So what I'm doing is I go to clinicals from like 8 to noon, like 8 to 1. And then from there, I go to work after if I'm scheduled to work. I'm still working. I still have a full-time job. But like I said in the previous videos, I'm using my vacation time to go to my clinicals. So yeah, it can get tough. Like, I start my day at 8. I go to work at 1. And then from 1 to 5:30, I'll stay. Or maybe I'll decide to stay extra until 7. So it's just really long days. And in addition to that, I'm also trying to like accumulate comp time, which I've also made a video about that. So I'll link that video up here if you guys don't know what comp time is. So I'm trying to accumulate all those hours and stay on top of my work. So it's crazy. But anyways, you guys are probably wondering what kind of like patients we see and what kind of diseases I've been seeing. Honestly, we've been seeing a lot of chronic illnesses. I see like the vast majority of my population in the clinic are Asian, and also like patients that are just older or like Spanish speaking. The issue with that, I feel, is that a lot of them need translators, and it's like really hard to try to communicate because you don't really understand each other. So you have to like rely on the translator, which is usually an MA, and that's a little bit more difficult for me because at the same time the visit doesn't go as fast as maybe it would in other clinics where the patient speaks English and, you know, all that. But other than that, it's going well. I think you really have to develop like trust with your MA and make sure that they're relaying the information that you're giving them, and that the information that the patient is relaying to the translator, that's also being relayed to you. So that's a little tough. So yeah, I've been speaking some Spanish at my clinicals, but it's just not as much as other languages because there's a lot of like different Asian like populations that go there, so there's like so many different languages. But yeah, that's a little bit hard. But we do see a lot of diabetes, dialysis patients. We don't do dialysis in the clinic. Apparently they used to do dialysis, but not anymore. We just like mainly diabetes, hypertension. It's really a lot of management of chronic illness, like I've already mentioned. We've also seen a lot of ear, like cough, cold, ear infection, strep, but nothing like really crazy. Obviously like strokes, hospital follow-ups and stuff like that, but it's quite a learning experience. I feel like, okay, like yes, I'm a nurse and I have some basic knowledge, but it's still not the same. Like I still feel kind of lost. And sometimes I just wish I would have probably just went to like a brick and mortar school, or like actually like attend class in a classroom instead of like online, because online I feel like, I don't know, I feel like I'm missing a lot of information. Now thank goodness like my preceptor is teaching me as like we're seeing these patients, because I'd be even more lost. But the good thing is also that she has provided me with like different, well, like I said, she's a PA, so she's provided me with like pharmacology videos and all these different types of lectures, so that's super nice. She also, the first day like we met, oh my god, she gave me like a stack of these many books. It was insane. But she's actually also given me like homework, kind of, not like in a sense where, oh, if you don't do this like it's gonna be graded, no, but it's just like she wants me to read this book right here. So I'm reading this book. It's actually like pretty good. It's called The Current Medical Diagnosis and Treatment 2019. You guys, you know, look at this. I've read most of the ENT, but she told me on Friday that she wanted me to read the pulmonary chapter, which is like so long. So really what she wants me to do is read the chapters, and then when I go back we just discuss them, like if I have questions and stuff. So this weekend I'm supposed to read pulmonary, and I haven't really started because I'm trying to catch up on all the patients that I have to input into my in-place. That's a whole different thing, you guys. It is so hard when you have to input like over 40 patients a week into that in place. It's insane. But that's where I'm like lacking, because it's like if I'm going to clinical, if I'm going to work, obviously after work and I'm getting here like at 7:30 or 8 to my house, obviously I don't want to be putting in all these patients into, you know, the system. Like who the heck has time for that? So I leave it till the end of the week to input all the patients, and that's where, you know, backfires on me, and that's where I get like really overwhelmed. But this week I'm almost there. I only have like, I have to input like 12 more patients, so that's not bad. But the thing is that 4 patients take me like 2 hours, especially if they have a long list of medication. Like, oh my god, I don't know, you guys probably are not understanding what I'm saying, but I'll probably make a vlog and where I'll share with you guys what it is that I have to exactly put into the in-place system to show the patients that I've seen, because it's just too much. And I'll share that with you guys in another video, like I said, probably in a vlog. But what else can I tell you guys? Let me look in my phone, because I actually did like write down some points, just I didn't want to miss it. Oh yeah, the other thing that I realized, now that I see it here, the other thing that I realized that really sucks is that, okay, so I became a nurse practitioner. Well, not became, because I'm still a student, but I want to become a nurse practitioner because of the autonomy. I wanted to have more control like over my patients' care and all that. And maybe it's just in this clinic, but I feel like the care that is provided to the patients, there's certain medications, there's certain supplies that the insurance will pretty much dictate what it is that you can order and cannot order, and that drives me insane. I hate that so much because it, like, I feel like it limits the provider as to like what the appropriate treatment should be, and you can't treat them that way because the insurance doesn't cover that. That drives me insane, you guys. But I don't know, I guess you just have to deal with it. But yeah, that's another issue. Also, I have been using my H&P notebook, but now what I'm starting to do is just use like a template where I write down like information for the patient. And like I said, I'll mention that in another video. I hope that I don't have to do half days for much longer. I know for this week and the next week I will be doing half days, and I think after that she'll be going back to full-time days. So my plan is to at least complete minimum 100 hours this February, and so I can finish before the end of March. I want to finish in the beginning of March just because I'd rather just get the hours over with now. That way I don't have to worry about going to clinical, doing homework, studying, and going to work. It's too much, you guys. But after that I will be on a break from, like, if I finish, hopefully I'll update you guys, but the plan is to hopefully be on a break for about 2.5 months, two and a half months, yeah, around there, and just relax and not have to deal with school. Well, actually I'll still have class until the end of March, but I just want to finish my clinicals in the beginning of March. So yeah, I'm excited for that, and I'll definitely be seeing you guys in another video. I hope that this video was like at least helpful to some of you, and I'm sorry I've been away for so long, but I've just been so busy, and I'll definitely be going into more detail in another video. Like I said, probably in a vlog. It's just easier to film that and just easier to edit. But anyways, make sure that if you are interested in any more of my content, that you subscribe and that you also check out these videos right here, and I will see you on the next one. Bye.